Well, good morning, Jaginder Rana here. The topic for our discussion today is: do smoking and drinking impact your health insurance? Do smoking and drinking impact your health insurance? Say, 56-year-old Ravi Sinha was taken aback when his insurance provider denied coverage for complications related to his liver cirrhosis despite his long history of paying premiums and disclosing his drinking habits. He found himself paying out of pocket for his treatment, unaware that any condition directly related to his drinking would disqualify him from benefits. Yet I had paid premiums for over 5 years, he says. So insurers often reject claims linked to conditions arising from smoking or drinking, like liver diseases and lung cancers, viewing them as deliberate risks. The fear there would be too many claims. If the patient continues to smoke and drink frequently while dealing with the habit-related pre-existing ailments. So this would then seem like underwriting a patient's self-indulgence. So this is what dissuades health insurance companies from accepting such proposals. People with conditions such as liver cirrhosis or are denied insurance coverage because it is mostly the result of alcohol abuse. Many patients worry about their insurance money and request us not to mention drinking as the cause of liver damage. We have to tell them to change their doctor. Many patients do that, trying to get their cost reimbursed. So if you are a heavy smoker or drinker, you are likely to be denied insurance coverage altogether. The disclosure may work against you for certain diseases such as liver cirrhosis or heart attacks. So for those who get the policy without declaring their smoking or drinking status, their claims for unrelated diseases could be denied on investigations of medical reports. So for instance, a person is admitted to the hospital for dengue. If the insurance company realizes that they did not disclose their smoking or drinking habit while vetting their claims, it may refuse to process it altogether. This can happen even though dengue is in no way related to smoking or drinking habits. So, what are gray areas? While most insurance providers say that smokers and drinkers are covered, in reality they might find it extremely difficult to get coverage. While insurance premiums go up for terms plans, insurance plans that provide benefit to the nominee if the policyholder dies, most companies do not have a separate pricing for health coverage. So if a person smokes more than 6 cigarettes a day or drinks more than 50 ml alcohol every day, they will not be able to get an insurance policy. So most companies do not check for smoking or drinking status prior to selling a policy, but a user must declare it or risk denial of a coverage. So the condition of the lungs or livers can be very easily be detected on liver functions, tests, x-rays and scans that are routinely done when a person is admitted to hospitals. If the company finds evidence of smoking or drinking in these tests, they are likely to refuse coverage. Even for those who make proper declarations, the insurer can refuse coverage for certain conditions. However, this doesn't mean that smokers and drinkers cannot get any coverage at all. This is where the role of the treating doctor comes in. Coverage will be refused if they say that a certain condition is caused specifically due to smoking or drinking. All companies have a standard exclusion for self-harm in their policy wordings. So while this applies for, say, hospitalization due to suicide attempts, it also applies to smoking and drinking that causes harm to the policyholder. The doctor's dilemma is that this assessment poses a challenge for doctor arriving at the right diagnosis. Insurance providers always insist on a diagnosis. Sometimes we may treat persistent fever symptomatically without diagnosing what led to the fever. Insurance providers, however, always insist on a diagnosis. So this leads to a lot of back and forth between his team and the insurance providers. So we have to answer questions just to ensure that our patients actually get covered even after they have paid their premiums. Now a doctor says that while consumption of alcohol or tobacco may be harmful pursuit, there has to be a sympathetic approach for those who have these habits. It's an addiction at the end of the day, and they should be entitled to receive treatment. So he suggests a middle of the road approach where insurance companies could charge higher premiums for people who smoke or drink because they are at a higher risk of several diseases. This will not only ensure that they receive timely or appropriate treatment, but also honestly in reporting their smoking or drinking habits. So right now people are worried that they will not be covered and hence do not want to give a proper history to their treating doctors. Let's see the cost of tobacco consumption. A 2020 study from India shows that for every rupees 100 that is received as excise duty from the tobacco products, a sum of rupees 816 is imposed on society for its consumption. Now this can be in the form of direct costs such as the money spent on the treatment, transportations and living expenses incurred during treatment among others. And direct costs such as loss in productivity when a person misses work for treatment. So the highest impact of tobacco consumption is felt in poorer families that are more likely to pay out. That are more likely to pay out of pocket for treatments or at least their right costs. So the patients who have paid for coverage should not be denied claims. The insurance products are designed by the company so they can choose to have higher premiums. For those who consume tobacco, having paid that, there should be no ground for rejecting claims. Increasing coverage for services such as de-addiction therapies, however, will not be effective. So for a person who is already paying a higher premium because they are smokers, offering offering a dedication services will not help much. Once you purchase the policy, what is the motivation for going for these services? People can kick their habits only if they want to, and the intention will come only when these services are a part of the routine checkups or consultations. But remind that if you are a heavy smoker or drinker, you are likely to be denied insurance coverage altogether because the disclosure may work against you to certain diseases such as liver cirrhosis or heart attacks. So for those who get the policy without declaring their smoking or drinking status, their claims for unrelated diseases could be denied on investigation of medical reports. Thank you. Thank you very much.